Particularly, we use every medication in clinic, but still don't get any results in some patients. For mental retardation and autism, we have some patients who we don't get any response with. So I'm going to focus on them. Strategies for treatment: refractory severe disruptive behavior disorder in autism and mental retardation. Now, why are there more behavioral disorders in these children? This is a very known situation. Children with developmental problems may have up to 4 times the likelihood of having a concurrent mental health diagnosis when compared to children who are typically normal. And children with autism may present with additional maladaptive behaviors, including aggression, self-injury, and severe tantrums of irritability are very frequent. Aggressive behaviors are associated with negative outcomes for children with these children and their caregivers or parents, including decreased quality of life, increased stress levels, and reduced availability of educational and social support. And also, it negates the education as well. Moreover, aggressive behaviors are often associated with negative outcomes for children with developmental disabilities as well. And aggressive behavior also contributes to negative outcomes for caregivers of these young children, and financial problems and lack of support of services. And it also negatively impacts on daily lives of these children and their caregivers. Development of effective therapeutic and pharmacologic methods are crucial. Behavioral strategies, as you know, include functional behavioral assessment, reinforcement techniques or strategies, and functional communication education all play prominent roles in reducing the frequency and intensity of the aggression in behavior in ASD patients. Also, there are some interaction therapies between parent and child. It's one of the models that is used to be and known to be very effective. Especially parents, in their approach to these children, need to set more clear rules and stay calm when asking the child to do something, and ensuring instructions are clear and proper for child's age, and also explaining the outcomes of disruptive behavior to your child calmly is crucial. And also, we know that parents may also react badly to such events. And a patient of mine came to me and said that my child is so aggressive that he's my own child, but I sometimes want to kill him. I might be going to kill myself from my child, he said, a patient that came from Dubai. So, he says we're at that borderline point, he said. Second-generation antipsychotics are the most commonly employed first-line pharmacotherapy options for the treatment of these aggression in autism spectrum disorder. And we mostly use the FDA-approved risperidone and aripiprazole with proven efficacy, and we use them as well. Now, we have used all of them, let's say, and also risperidone especially is golden standard for aggressive behavior, which you very well know. Also, hyperactivity accompanies the ASD patients most of the time. However, efficacy is less favorable and adverse effects are more frequent in this population, and lower dosages are required due to increased vulnerability to adverse effects and fluctuation of mood and behavior. Additionally, we have some antipsychotics and antiepileptic medications used as mood stabilizers, and several glutamatergic agents are used as well. So valproic acid in terms of mood stabilizers don't seem to have an effect in randomized controlled trials. Additionally, in my own experience as well, I have not seen valproic acid being very effective on aggressive behavior. And sometimes naltrexone was something that I used for some time, and then without seeing these randomized controlled trials, I decided that they were not effective, and I ended up not using them. And in randomized controlled trials later on, naltrexone was deemed to be inefficacious against aggression. There was something rather promising, a randomized controlled trial near that. NAC is very promising in that regard. And Harden and colleagues had a trial in 2012, and there are 8 or more placebo-controlled randomized trials in this area, and all say that NAC is well tolerated in aggressive behavior with good efficacious results. But I have no experience using that, so later on I'm planning to add NAC to my therapy and daily practice. Placebo-controlled trials showing the efficacy of NAC, and those is generally varying between 400 and 900 milligrams. I don't know. Well, NAC we use for coughing. Do you know the dosage of it? So, for ordinary cough, maybe 1 tablet might be used, but as a result it has an antioxidant effect and no serious adverse effects. Therefore, we could use it altogether. And also in hyperactivity symptoms, guanfacine has been found to be rather effective in randomized controlled trials. But as you very well know, it is not available in Turkey, and we only have NAC that is available, and for us also clozapine that I'm going to mention is also an effective option. For what do we mean by treatment-resistant patient? Right. Do we mean, for example, we try ketamine as antidepressant, and use of ketamine meaning resistant to 6 antidepressants, we could use ketamine for these patients. In schizophrenia, for example, at least 2 antipsychotics need to be given the required time, and if there's no response, then we call it treatment resistant. And also, we don't have a criterion available. But when I evaluate my patients in terms of evaluating on being treatment resistant, there is no medication that is not used. They're all using effective doses for a long time. None showed any effect. And patients have at least had taken 5 or 6 antipsychotic or psychotropic medications. So I'm going to share my own experience with these kind of patients. Combining the antipsychotics and that efficacy of that again requires is an area for research, and clozapine is the medication on the forefront, and in schizophrenia it is the gold standard and more effective than all other medications. It is something we use, and clozapine is crucial for anti-aggression and has an anti-suicidal effect, and also it's effective in substance use patients as well. And for suicide, in suicidal patients, clozapine is very effective, and it has an anti-suicidal role. It's also anti-aggressive, and in the researches we see that it has been effectively used against aggression, and it decreases aggression at a very prominent level. Now, looking at the anti-aggressive effect, we have a systematic review on the evidence of clozapine's effect as such, and we have aggression accompanying almost all disorders. Acutely and continuously, clozapine is effective. Clozapine in the treatment of aggression in conduct disorder in children and adolescents also is a randomized, double-blind controlled trial here. And also in clinical psychopharmacology, there was a new article published this year in 2019. It's also very effective. Clozapine is also very effective against aggression in this group as well. This was published this year, so a very novel trial, so to speak. This study was aiming to compare the efficacy of clozapine and risperidone for treatment of aggression in children and adolescents with conduct disorder. Clozapine was more effective, or let's say clozapine was not only more effective than risperidone, but also in only 2 patients, neutrophil level decreased. In 2013, in conduct disorder, we have a trial that was published in the Orange magazine, and well, the second one was similar to the initial presentation. Now, there is consistent evidence that clozapine is more effective and it rapidly controls aggression and psychotic symptoms than other antipsychotics in schizophrenia and personality disorders, affection disorders, and substance abuse, along with mental retardation, and it doesn't cause any dyskinesia. However, we refrain from using clozapine. Why? Because it decreases the neutrophil count. But trials focusing on antipsychotics and clozapine show that clozapine does not decrease neutrophils more than other antipsychotics. So it decreases neutrophils very gradually and slowly. In our patients in the Bakırköy hospital, in about 70% of patients, we only had 1 case where neutrophil count plummeted, and leukocyte was about 3,000, and neutrophil level fell below 1,500. We had to stop that, therefore, in one of the patients. Berech and colleagues reviewed the charts of 6 individuals with autism spectrum disorder who were treated with clozapine for aggression. Clozapine treatment was associated with a 2-fold reduction in aggressive behavior without decreasing of neutrophils. Most frequently seen adverse effects is hypersalivation and constipation. This is our experience from Bakırköy. All the Bakırköy team is listed here. We see retrospective investigation of clozapine treatment in autistic and non-autistic children as inpatient clinic in Turkey. And here we have 37 patients, 17 of whom had autism. And only in 1 patient, and that was the one I was talking about earlier, no decrease in neutrophil count occurred. Other than that, apart from constipation and siluria, no prominent adverse effect was observed. Epilepsy threshold might come down, as you know, but if you go over 400 milligrams, then valproate as an anti-epileptic is added. But I could also say that, and I'm going to talk about this patient from Dubai that I initially mentioned, there was resistant epilepsy. Was a resistant epilepsy patient, and for 10 years the family was trying to cope with epilepsy, and there were very strong and frequent episodes. They were taken under control, but they live in Dubai. 10-11-year-old girl was the patient, and this girl tours in a car for 12 hours a day, and when the engine of the car stops, the child becomes very aggressive, and the child starts pulling hair off the other family members, starts biting them. They sometimes tour all of Dubai. When they come for treatment to Istanbul, they start traveling around Istanbul for 12 hours a day because the child demonstrates an extreme aggression when the moment engine stops. So, with a patient with such aggressive behavior and a severe epilepsy, clozapine resulted in a miracle, so to speak, and the family invited me to Dubai, and I went there for a follow-up examination. So, well, while I went there, I also toured around Dubai, and I really wanted to see the kid, and I saw that the result was brilliant. Aggression has completely gone down. The child is very happy, the parents were very happy, and no epilepsy was present as well. While the child was using epileptic drugs, talk to a neurologist. They may give topiramate, which will stop weight gain and which will also block epilepsy, and neurologist agreed to it, and now patients receiving that, and no episodes and no aggression is present. A miraculous result, so to speak. In an epilepsy patient, I have never used clozapine in such a severe case. I never expected this kind of result, but it was brilliant. Show you a video. Can we turn the sound on, please? I'll give you some information about the patient I'm going to show you in a minute. On this kid, for 10 years, almost all medications were tried. An autistic patient came to me 10 days ago, and the child is hitting his head all over the place, and there are big swellings on the head of the child, and also he's biting his mother all the time. And we started clozapine, and the initial prescription was 8 milligrams of risperidone, 1,000 milligrams of depakin, ketiapine 400 milligrams, and 400 milligrams of largactil. And despite that, the kid was still very aggressive when he was first presented. So I started Repolex, 25 milligrams once every 3 days, and once every 3 days I increased the dose by 25 milligrams. And in that aggressive case, I can go up to 200 milligrams, but try not to exceed that. I only exceeded that in one of my patients, which we went up to 300 milligrams. And a week later, the patient came to me with blood test results, and levorexin was improved to 75 milligrams today. And the patient came for a follow-up examination. Well, there's no hitting now. He's not hitting his head now. So what is he doing? This is the mother speaking, by the way. Could you please show me your arms? He used to come and hit his head against me and then start biting me, and now there are a lot of swellings on his head right now. Which areas could you show? Those areas. It's because he hits his head all the time, right? So what is the situation after this medication? He's calmer now. He doesn't hit his head, or he hits his head less, and we're at the low dose. And his sleep has improved. Very good. And there's no swelling now because he's not hitting his head around, and he enjoys it. Very good. As you see, he was very calm. He was very calm throughout the interview.
Şöyle geçiyoruz. Yani akut etkisini.
I'm going to talk about acute impact of clozapine. In just 1 week, from a point where he was never sitting, he was pulling the hair of his mother, he was smashing his head against the wall. Now in 1 week, he was far more calm. Let's look at the side effects of clozapine. Agranulocytosis is not a side effect to fear. In Bakırköy Hospital, we have used clozapine for years. No deaths occurred. In the cases that I have used clozapine, no severe adverse effects were observed, except one case where neutrophil count plummeted prominently and leukocyte count also decreased seriously. And 1 week later it fell to 2,800 and we had to discontinue the medication. And the father was using clozapine as well, so they said that we want to start this kid with clozapine again, and we re-challenged, we retried the clozapine. Now the literature shows that once it decreases the levels of leukocytes and neutrophils, it decreases it again when it's reused. Therefore, we detected that in the follow-up, and once you discontinue the drug, the leukocyte level goes up again. I haven't seen any cardiovascular side effects, but especially in adults with cardiac events, history of cardiac events, it might perhaps have some cardiac side effects or cardiovascular side effects. As long as you don't exceed 400 milligrams, you don't have seizures of epilepsy. I only had one, I think, when the patient was at 300 milligrams. Could we wrap up? We're almost up in terms of time. Well, no other problems. Well, in my patients in Bakırköy Hospital and Balıklı Greek Hospital, I focused on autism and mental retardation. My patients were aged between 10 to 19, and the mean age was 15, showing that the treatment with clozapine decreases aggression prominently and leads to a reduction in the number of psychotropic medications needed to manage behavioral behaviors. Why I couldn't get the result in one of those patients who was Syrian, I felt like that I couldn't offer them salvage. In one Syrian patient, we acquired no results. Clozapine was tolerated very well, no side effects occurred. To sum up, clozapine is effective in treatment-resistant aggressive behaviors in this population. And clozapine treatment was associated with reduction in aggressive behavior. And we start using it in the clinic. There were some patients which I admit for CGH, but for clozapine, that's not the case. Thank you very much.